So along with this coverage, we proceeded on with consultation from our NUHM that under this comprehensive healthcare, primary healthcare, we have 12 expanded packages, services, and from there we chose to look into one of the package that is screening and comprehensive management of non-communicable diseases, and to reflect on two non-communicable disease which is so common now, that is hypertension and diabetes mellitus. We all know that India is faced with the dual burden of non-communicable disease as well as the communicable diseases. And all this can be prevented with early diagnosis, early management, providing health education and timely referral. So with this focus in mind, on 15th of January 2022, under the chairmanship of our District Health Society, Kohima District Deputy Commissioner, along with our President, AKMWP, and ward chairmen, we have 19 wards with pockets of 50 colonies. We had a sensitization, and we thought we'll take this package forward to go to the colonies to have mini health camps for diabetes and hypertension. We conducted 54 sessions across 34 colonies. So here, small colonies we combined together into one. So the sessions were at 34 colonies. 42 participated, 34 colonies conducted. 17 medical officers from the urban PHC, also from the medical officers from Kohima District PHC, CHC, we all came together to have this session.
I thought of not to share about it. Madam has already highlighted about extensive about it regarding the NCD and how this is prevalent now. In Kohima population, we have around, according to Indian Council Medical Research, Indian Hypertension Control Study, there's one group is going on here in Kohima and Mokokchung. Kohima, they have detected, about 30 years old, they have detected around 18,000. Whereas, Madam, your report shows 30 years and above is 15,000. Anyway, it doesn't make much difference, but it's really a worry figure for us. We tend to forget that there is no pain, no fever, no cough, no symptom. We tend to take it very lightly. And this is called as a silent killer disease. Silent killer disease, hypertension. And you know, this diabetes and hypertension, they're just like brothers and sisters. The food habit, the lifestyle, yes, we are talking about it, but it's a very hard to practice for us because of our sedentary lifestyle. We just get into the car, go back to the office, come back to the car, back to the bed or kitchen, you eat food, sleep again, the routine starts the same thing. I think I don't need to tell you again. But now here I want to request, when the presence of this Panchayat, make sure that, I think some link, it should be action-oriented. We should link to something that we need to walk. We need to walk. Everyone should make sure that at least some kilometers, one has to really walk. Sweat, like in those days of all father's time. I think that's the only way, otherwise.
The right message, the right treatment is very important, and I hope this social health responsibility campaign has been able to convey that. I congratulate the team for having carried it out in a short time, but we need to expand it further. One of the things which have come out very clearly is the prevalence is very high in our Kohima town. I was noting out of the 15,131 plus who were covered, the more than 12% have some form of health condition, non-communicable disease, which is a very high prevalence in the society. Of course, if the sample size goes up, maybe the percentage will come down, but since I think it's quite representative, it's not a very comfortable figure for any health professional or even for the community, and I think we need to look at it from that perspective. We need to all act together at the individual level, at the community level, and at the government level, act together to ensure that this doesn't become a silent pandemic which will affect our people severely in the long run. Now, in order to ensure that our people keep getting the right health facilities and right health treatment, the government also is taking a lot of steps. In addition to increasing the existing facilities at the, whether it is at the NHK, whether it is at the urban health facility level, whether it is at the CHC, PHC rural level, we are doing a lot of things. We are using the central health schemes also. We are using our own funds. We are trying to get funds from whatever other sources possible. We are trying to improve the beds available, the diagnostics available, the manpower available. Everywhere we are trying to act. In addition, two major initiatives which we are hopeful will be able to successfully implement this year. One of them is getting the medical college off ground. We have put in a lot of effort. The entire roadmap has been laid down. It is a challenging thing, it's not an easy thing to do, but we are hopeful we'll be able to move an application to the regulatory agency, the National Medical Commission, within the laid down timeline of July or so, and hopeful that the National Medical Commission will handhold us, work with us, and give us the necessary permission. We are dependent on the National Medical Commission for giving us the permission. We are at the government level taking a lot of steps. We have created posts, around 60 posts, if I haven't forgotten, 60 posts of senior faculty have been created, and the process for recruiting the director campaign has already been initiated. Other faculty positions also will be recruited. Other posts also will be created, I hope, in the due course, and there shouldn't be any lack of effort from our side as far as establishment of this medical college is concerned, which will keep us wanting from getting the permission. Hopefully we'll be able to have the admissions for the next academic session in the medical college. Number two, we are also, the Chief Minister, Honorable Chief Minister had announced in the budget, this year's budget, that Chief Minister's health insurance scheme will be launched during the year. There also a lot of work is going on. In this health insurance scheme, we are aiming to cover the entire population of the state, to provide them health insurance. Everyone will have a health insurance, wherein at least 5 lakh rupees cover will be provided for any inpatient health facilities that have to be availed by the family which is covered. The work for this also is being carried out by the Directorate and the department on a war footing, and we hope that by October we'll be able to launch this scheme successfully. With these two, the objective is that access to health facilities become easier. Access to quality health facilities become easier. With medical college, we hope the quality of the physicians will go up, quality of the professionals will go up, more professionals will be available. With the health insurance part, we we are hopeful we'll be able to bring down the out-of-pocket expenditure, the expenditure which one has to make in order to avail of these health facilities. With this, we hope the treatment part will be taken care of. In case anyone has gotten into an NCD condition, he should be able to, a severe NCD condition or serious NCD condition, he should be able to avail of the right treatment. We are hopeful we'll be able to take care of, but I repeat again, prevention is the most important thing. The message which should go out is take steps at the right time to ensure that we do not have NCDs. And there are two things which are required for prevention of NCDs. One is keeping oneself fit through exercise and eating the right diet, controlling our diet.
This is a very, very good initiative in the history of Nagaland. It's just beginning. Out of this screening, we have got new BP cases, that is 269, which our CMO has already presented. Out of these diabetes, new 69 person has been screened. So now we were not knowing this, and again, both diabetes and blood pressure, they could screen 24. These are all new cases. They were all new and they were not knowing that they had a disease in them. But out of this screening, these new cases are now under treatment. How nice it is. The most important is prevention, which we are not knowing how to prevent ourselves from the diseases. American naga managan to pet kuni dangor hobo competition ko thaye man khaige na dokane help biya se dauro khabole competition ko thaye it upra American la help sob biya hoya ase. Blood is high blood pressure. American no hunya se kintu kile stroke pa ase because of high blood pressure. Let this be a beginning and let us go furthermore better way to achieve it. There are a lot of programs in the medical department which the community have to understand. Supposing from childhood, immunization program. If you can encourage your mothers in the colony, take your child for immunization. Polio, bacha time polio, polio na pabo. BCG highly to when you grow up, TB na pabo. Pertussis, poila to monkey la cough kugena cough kugena bhitar jana. The DPT, diphtheria, tetanus, and pertussis. Itu DP triple. Itu marle to bemar itu para tamul hole bemar hobo. Inga medical to bishas de. Itu jana American community can be. If you don't know, you consult the medical department. Ki bole bhalo amila bachane. Amila health garni. Janya pacheti, you move forward and keep yourself body fit. Kiman bhalo American be Kohima team one colony ase. Abnegan plan kurgena morning 1 hour exercise. Idu community ti halili kimam people. Young to the oldest. On ek khanda pass na ulai dile ekdam bhalo. Or there are so many educated unemployed knowing yoga, physical teacher, exercise sika bole. Community kan 10 taka hole contribute again na mahina ti tayo TV. Tayo apni kang iska bole TV. Morning ti Kohima town colony sob exercise ko thagile kiman sundur ho. In that way we can live longer. Life is very important. Kun bhi morbole mon nai tu. কিন্তু কোনটি আমি লাগা বডি খেয়াল করবেন না জানি মুরবলে তো মন নাই খেয়াল করবেন না জানি ইদো গাড়ি from today onwards including me I'm telling you I'm also a very lazy guy we don't want to die but we don't know how to care ourselves therefore from today onwards let us all try let us all start and I would like to request our SPO Director Health and Family enriching if you can have a meeting with an NCD program officer, like the way you have screened Kohima, if you can screen all over the districts to our staffs, it will bring a wonderful change in Nagaland.
First of all, I would like to give my solemn gratitude and thankfulness to our Almighty God for bringing us all together here and for making our mission successful up to now. I would like to say something to my colleagues, my dear ward leaders, who have given their time and energy, effort, everything into this campaign. Though we are short in many things, but I hope department is also satisfied with the words. Earlier, before this campaign, we had close relationship with two government agencies, Administrative Department, DC Office, and KMC. We have no other relationship with any other department. Rather, when it comes to CMO, earlier, even if we try to contact them, they never come forward. I don't say they don't cooperate, but this time, when our CMO, Dr. Vezokola, came and took over charge and started this campaign, the first meeting was held on 15 January at DC's office to sensitize this program and the objectives. We were very confused. Kohima being the capital, we were wondering whether it will be able to be completed or not, in time I mean. But energetically, through the able leadership of our CMO and the dedication of the staff, the campaign, the whole area was covered, the 19 wards, everything was covered within 45 days, which is a Herculean task, which each and everybody cannot fulfill in such a short time without strong dedication and leadership. Our ward, when Vezokola came and took over as the CMO, she also created a WhatsApp group where we have become a small global village to understand each other, hear from each other, get the message. We try to cooperate, and we, on our part, I hope we have done our best. But the best, like an examination, whatever best we have given, it may not have reached the 100 point. We may be lacking in so many things. I hope the department understand it and try to, later on, try to cooperate with us again in other campaigns to which we are all willing to cooperate and give our effort to medical department, specifically the CMO office, who is looking after the district. I, on behalf of all the 19 wards, would like to convey that even in future, anything you require for us, and anything, whatever you are going to do for us, please don't hesitate to intimate us or try to reach us. I, on behalf of all the 19 wards, will convey today that even in future, we are ready to cooperate with you in whatever ways, in whatever things we can do in a small, humble way. Our words today may not be the proper platform to say about our problem, but it is worthwhile to inform when all important dignitaries are here that the biggest challenge and the biggest problem we face is fund. We are very much lack on fund. Anything we want to do, we require some finance. I don't mean to say we are asking for financial assistance from you today. I don't mean to say, but when I say about our problem, it is good to know about each other. Our problem we face should be conveyed to the departments and to everybody, that we are not asking any fund from anybody, but the biggest hurdle with the wards is fund position. Because we are functioning with zero budget. We, the leaders, they are functioning with zero budget. We don't have anything. If it is a village, we get VDP fund. There is a lot of money coming from central, but our panchayats, we are not under Panchayati Raj, nor we are under Village Council Act. There is no source of income for us, but still then we are trying our best, striving and struggling to cooperate with the government. So in our humble way, we are always here to contribute, even in the smallest way.
In my ward, like any other ward, and it have opened our eyes. The ward I represent has been detected the highest numbers of persons having high BP and diabetes, according to the reports. Personally, I feel that the campaign was absolutely necessary and extremely important for common people, especially for BPL families. Unlike other times, this 2 days program held in my ward, many of the residents who do not care much of their health, they came forward and get checkup done. Even myself, I have done my sugar test on both 2 days, my BP measured, and you know, your residents who never cares for themselves, their health, like, shopkeepers, drivers, housewives who hardly move out from home, then some daily wages earners, grade 4 fixed pay employees, unexpectedly, people responded so well. And actually I want to request the department also that if possible, please conduct another health free camps more and more. We welcome that. We are ready to render our service. Grateful to CMO office this time for giving us some amount of cash in advance to meet some exigencies. Actually, as my president has said, we panchayats are financially not sound. We don't get any financial assistance from the government. And all kitchens in Kohima town, all of us, each one of us, we are paying rupees 70 in a month as our sanitation fee. Then besides that, business establishments in Kohima all are paying the yearly tax to different groups and factions. So panchayats are left with no option, no choice, no alternative, even to go for fund drive. The little amount we have given to us, that was a lot to us. Thank you, CMO Office Kohima. Other days, I have no say, but these 2 days campaign organized in my ward, I found our health workers very punctual, sincere and dedicated.
Time is given me for the closing remarks, so perhaps this is an occasion to thank everyone who have participated and has been a part of this successful campaign. First of all, I would like to, on behalf of the district administration, thank the Chief Medical Officer Kohima, Dr. Vizokolu, for the initiative, for coming up with this noble concept of going for the social health responsibility in the town, particularly in Kohima town. It was a good initiative, I should say, and whatever we have done, we have just lended moral support to her team, And then that's all from our side. But the rest, due to the commitment, the dedication from the medical team, I think things have been very successful because of the role that they have played. This team has been wonderful, I should say, particularly the medical team. I think they've done more than what they are supposed to do, even in the times of COVID. And for this initiative, I think their performance has been outstanding, and I hope that they will continue with the same spirit. I also thank the department, without whose guidance and the assistance required, we would not have been able to do much. But the kind of support that we have received from the principal secretary and then the directorate, the officers involved, I think it has boosted our morale, and we have been able to do, given us the driving force, the initiative. So we would like to thank the department also. I'm sure many more things will come up. I expect all of you to join hands and then cooperate and lend each other the support so that we work for the welfare of the people for whom we are occupying our respective positions.